Assalamu alaikum and a very good morning to you all. I hope you guys are doing very well today and you're ready to kickstart your week with me, Maha Maktoum. I hope you had a very nice weekend and you are, like I said, ready to start your working week. Today we're going to hit the ground running. No easing into the shows today. Today is actually World Diabetes Day and it is observed internationally because this is a growing crisis all around the world. Currently, 415 million people are suffering from some form of diabetes. By 2020, they're expected the figure to go up to 642 million. Now, these are figures of people who are on record as having this illness. But as we know, within our countries, such as developing countries, the figures aren't so precise. So the figures could be much higher than that if we were to combine them. Now, the reason why we're observing this is because with diabetes, if you are prone to it, you can prevent it by certain lifestyle modifications. If you already have it, there's ways to make your life better. And also, we're going to be talking about what is the situation in Pakistan, what are the different types, how can we improve our lifestyles, what are the consequences, how can we avoid them, and also move forward. Because without our health, then there is no point to life because it will become more difficult and we can't enjoy the little things. So to discuss that, I've just realized that we were discussing so much about the actual topic. I have left the names here, and I do have them. If you just bear with me, I will bring it. But let's go for a short break, and let me bring up the details for the guests, and then we will start the show. Stay tuned. Welcome back. So we have the details. I did have them. It was just we were so caught up with all the details. But we're very lucky to be joined by Dr. Rizwan Uppal, who is a general physician. Assalamu alaikum. Welcome back. Thank you for joining us after a very long time.
Thank you very much.
Besides Dr. Rizwan Uppal, we've been joined by Dr. Umar Wahab, who is a diabetic expert. Assalamu alaikum. Thank you so much for joining us.
Thank you so much.
So I'm going to start with you, sir. The burden of diabetes within Pakistan. Tell us what is the situation.
Yeah, thank you very much. First of all, I must appreciate PTV for taking this initiative on this disease today, on the World Diabetes Day, because this is a disease which should be addressed properly and at maximum level. And as a medical specialist, I'm thankful that you have invited me today to
we're thankful that you took the time out.
Discuss this disease and share my contribution as well. Well, diabetes is a disease which is quite commonly known, but is mostly unaddressed internationally as well. That's the reason that the numbers are on rise. As you were saying, it's more than 450 million worldwide. In Pakistan alone, it's more than 7 million people that are known to be diabetic. And if we count those who are not yet diagnosed, the number may be more. I usually say it's 1/10 of the population. If we roughly say diagnose, and those who are maybe pre-diabetic are those who are still not diagnosed.
Right.
And this is a huge number. And if you compare the number with 1980s, which was around 108 million, and today within less than 4 decades, it's more than 4 times. So it's a climbing number. And the figures that we are getting, they are going to be very discouraging in coming years.
Okay, so that's not good.
Yeah, so this is bad. But proper attention to this disease, we can bring this number graph down.
Okay.
And how we can, it's the awareness, it's the prevention.
And we'll be discussing all of these aspects.
Yeah.
So let me bring Dr. Wahab into the conversation. You're an expert in this. So tell us, from what you've seen, what is happening on ground level in Pakistan right now?
I just want to say a few words, and that Pakistan is ranked 10th in the world in diabetes. Okay. And if this situation remains the same, it will go up to the 5th in 2030. So Pakistan should take the initiative, more awareness, more educational stuff, and more education should be endorsed. Awareness is, I usually see in my patients that there is lack of awareness. They did don't know about their diabetes. Patients should learn what is diabetes, how many types are there, and they should start taking the measures to prevent it.
Okay. So let's talk about that, because that's the next the question that I had for you. Because the theme of this year is eye on diabetes. That's the 2016 theme. So let me ask you, Dr. Uppal, what are the different types of diabetes? What do we have? What are we dealing with?
Yeah, diabetes, first of all, diabetes mellitus is the condition where we see that the blood sugar level is raised. This is a very general, non-specific sort of definition for any reason. One can have a raised blood sugar in the blood. There are many types of the diabetes, but the type 1 and type 2, these are well known. Although the other type,
there are other types.
Like gestational diabetes, that is important that we should not miss.
Okay.
And few other types, maybe drug-induced and the autoimmune, maybe beyond the scope of this program.
Okay, yeah, because even I'm learning. I thought, I'm aware of type 1, type 2, but these other ones sound scary as well.
Gestational is very important, and we cannot miss that.
Okay, we'll talk about that one.
Type 2 is the main bulk of the disease, although type 1 is also quite common in the lower age group and the children. And the type 1 is the diabetes where there is total absence of insulin in the body.
Okay.
It may be because of the autoimmune destruction of the pancreatic beta cells which produce the insulin.
Okay.
And usually it presents in the early childhood, although the upper lives are also not immune to that. And the type 2, which is more than 90% of the diabetes, it's common in those who are adults who have obesity, and the lifestyle and other factors come into play. And if we try to address type 2 in this program, I think we'll be conveying good message with some emphasis on the gestational diabetes.
Okay, so tell us a little bit about the gestational diabetes.
Gestational diabetes is the diabetes which is usually picked in the third or last trimester, and it is the condition where the blood sugar rises because the hormonal situation changed in the body.
Okay.
And even the ladies who do not have diabetes, if they are found to have, or they are not diagnosed to have diabetes during pregnancy, if they are found to have a healthy baby, a baby which is more in weight compared to the normal, then we suspect the lady must be having diabetes, and then we screen that lady. And this is the normal protocol. Guidelines say that we must screen the mother for that.
Okay, interesting. Okay, now let's move on to actual type 2 diabetes, because that is the main bulk of it, and up to 70% of the figures of diabetes are people with type 2, if I'm correct?
Yes, more than that.
Okay.
Even it's more than that.
Okay,
yeah.
we're trying to be positive.
Yeah.
Okay. So let me ask Dr. Wahab, so what is type 2 diabetes? I mean, within Pakistan, what are the preventative measures? How do we tell, what are the symptoms, and how do we deal with it?
Okay. Type 2 is a diabetes where body doesn't produce enough insulin to meet the daily requirements of daily requirements.
Okay.
So that patient should do the exercise to meet the requirements, to do the diet control. This is utmost.
Okay.
And these are the cornerstones of the treatment. What are the signs and the symptoms? Signs and the symptoms are always, in some patients, they are always masked. So if the patient is having frequent urination, increased thirst, there's a history of weight loss, patient gets fatigued easily, they should consult the physician immediately. Few factors are also very important. One is the family history.
Right.
One is the Asians. Ethnicity is also very important. And obesity. If these three factors are there and the patient is having signs and symptoms which I've already informed, patient should go immediately to the doctor because this type 2 diabetes is a diabetes which can be delayed or prevented if the proper diet and exercise is there.
Okay, now before we move on to, because we've talked about that, that's prevention, so exercise, healthy living, so lifestyle modifications. But okay, I'm going to ask a very basic question, and I hope a lot of our viewers also probably think that, we've all studied diabetes when we did biology, a lot of like you said, within this kind of genetics, there's a lot of diabetes as well. But what is the importance of insulin?
I think if we start with just some physiology,
Yes,
and then
let's
we
do
can
that.
switch to pathophysiology. These are medical
Okay.
terms that will, and then the viewers,
Well,
I
we'll
think
try
they
and
will
keep it
enjoy.
layman, yeah.
Yeah, you will. We'll try to keep then, but the viewers will enjoy that
Okay,
and learn
great.
more. Basically, when we eat anything, sugar, fats, any calorie diet, it is first digested and enters into the circulation, goes into the liver. At that time, it is a pancreas, which is a small organ just very close to the liver and the stomach, which secretes a hormone known as insulin.
Yes,
It
okay.
is the insulin which then utilizes this glucose appropriately in the liver. It tells the liver to store excess as in the form of glucagon, glycogen, and to the muscles. Muscle cell tells them that there is insulin, sugar in the blood, and opens the gates of the cells so that this glucose enters into them, and then they utilize that. So this is the normal physiology.
Okay.
So what happens in diabetes? Either insulin is absent, type 1 diabetes, because of the damage to those cells which produce insulin in the pancreas.
Okay.
Any reason, autoimmune mostly. And the type 2, which Dr. Saab was saying, in type 2, either there is relative deficiency of insulin. Relative means that I'm too obese and my pancreas is not coping with that insulin, although it may be producing more insulin, but that is still not enough to meet those requirements. Or there may be resistance at the receptor level in the liver, or maybe at the muscles level.
Okay.
So that's the type 2 diabetes. So this is the pathophysiology, I would say.
Okay,
That's
excellent.
the reason.
Okay, now that makes sense. I'm going to take that question off. Okay, now as Dr. Wahab has also just said, that it's also the genetics that play a huge role in this. Now, within people who have children, they must be thinking, well, my parents had it, so their grandparents may have had it. How do they see the signs and symptoms, or how can they prevent their child or themselves from the onset of type 2 diabetes?
Yeah, type 2.
Yeah.
Yeah, genetics has definite role in diabetes, but what I have seen in the clinics as well, though anyone who is having diabetes in the family, usually the families are not too much aware, and they know that we are the potential diabetics.
Right.
So they somehow try to prevent if they have some health awareness or they are concerned about their health. And usually they try to prevent by maybe some dietary modification, some exercise, and the things that we will be saying in this program.
Okay.
I'm more concerned about the people which do have either genetic predisposition or other because of lifestyle predisposition, and they are the people which needs more attention. These are the people who remain in the state of denial as well.
Okay.
They say, no, I'm not going to suffer diabetes. And even if they are found to have 1 or 2 raised blood sugar level, they usually say, and what I have seen in the clinics as well, we can control it. I will bring it down. But they usually keep on saying so, and that they become the victim of the diabetes. And once diabetic, as Dr. Saab was saying, then we have to treat it. Then it's not preventable. Once we are in the club, then we have to be with that all those problems.
Right.
So genetics, yes, it's important. Genetics is something that usually somehow I consider now is a message for those who are potential diabetic, that beware, you have a diabetic at home, look after yourself.
Okay. Now, if someone does have diabetes, say one parent suffers, or let's stick with type 2, because if we keep switching between, we might get complicated. We'll go to type 1 later and the other ones. But with type 2 diabetes, if one parent suffers it, how much more chance is it for their children to have that issue?
It's almost above 50%.
Oh wow! Okay.
Yeah, it's almost above 50%. And adding to that, if the person is obese and taking a lot of fizzy drinks and soft drinks, have a sedentary lifestyle and erratic eating habits, and the chances get increased and increased.
So basically, more than 50% of this population,
Yeah,
we're talking about that.
more than,
Okay,
yes.
now let's address that. So culturally, how can we now, what are the solutions for that? Let's talk about those. So start doing exercise. How much exercise and what type of exercise should someone do? If it's in their family?
Yeah, exercise at least 30 minutes a day, and that is 150 minutes in a week, and that should be in a form of brisk walk.
Right.
Not a Humpty Dumpty type of
Okay.
walking.
Right.
So secondly, diet control. Lifestyle modification, eating at the right time. Breakfast is very important.
Right.
They should cut the lunch, but breakfast is very important.
Okay, and now in regards to what they should be eating, what should they be eating like
Okay.
specifically?
They can eat everything, but no artificial sugar should be there.
Okay.
Yeah, they should cut down the fizzy drinks. You know that each glass of soft drinks, I don't name anyone, contains 14 to 18 teaspoons of sugar.
Yeah. Okay, I'm getting really
And the
scared
daily
now, yeah.
requirement is almost 8 to 10 teaspoons in a day.
Okay, so basically you've just already hit the limit and then
Yeah,
more some.
exactly.
Okay, now in regards to the eating habits, like you said, healthy breakfast,
Yes.
smaller lunch and smaller dinner. First of all, is there a certain time that one should stop eating throughout the day? And is there certain things that we should be eating during these meals, like specifically?
Yeah, it's just not just the dieting, I would say. It's the diet modification that is more important in diabetes management and diabetes prevention. About the diet, it's not just the sugar, I would say. It's just the calories.
Okay.
How much calories we take. If we take more calories, whether it is in the form of sugar, whether it's in the form of refined carbohydrates otherwise, so they are going to add in the problem.
Okay.
For the patients, I would say, or for the general public, I would say the easy message is frequent small meals. The meals should not be too much based upon the refined carbohydrates. Refined carbohydrates are sugars and the bakery items, sweet bakeries, biscuits, cakes. So these should be avoided because they give you suddenly so much calories that suddenly your body has to deal with that. Insulin has to come up and the other things.
Okay, now we've talked about the importance of insulin, how it is there, what happens when you suffer from type 2 diabetes or type 1. But when you're having a meal, how does that work then? How does the whole treatment for diabetes, so if you have type 2 diabetes, you have the insulin and then you have your food, how does that all work?
Actually, if, as I was telling you in the physiology said, the insulin release and storage and everything, if you have so much calories coming in the body, then definitely the excess of the blood sugar will be initially managed by the pancreas and from the insulin.
Okay.
But later on, these beta cells burnt out in type 2 diabetes, and there is no insulin then, or low insulin then. And in that situation, then the blood sugar rises, and the complication of the diabetes later on start to come.
Okay.
So frequent small meals where body can handle them, and the diet which contains the three basic elements of the food: carbohydrates, fats, and the proteins. So in the carbohydrates, the sugars and the other things, they should be restricted. And the diet which contains more of the refined or polysaturated sort of fats, they should not be taken.
Okay.
It should be unsaturated fat like the olive oil. We call it a Mediterranean diet style of the fats like olive oil, the vegetable sort of oil to be replaced with the animal source oils, and the proteins and the specific red meat, mutton, beef. They should not be used because they contain too much of the saturated fats.
Okay.
So if we just restrict these things, keep them in frequent small meals, and the excess calorie that we have taken should be burnt out by exercise.
Okay, excellent. So we've talked about, we're going through this very quickly. I think we need to slow it down because we're going to run out of questions. But now, so that's, we've talked about the prevention, we've talked about the symptoms, and we've talked about how to handle it once you've got it. Now, in regards to the consequences of mismanagement, that's the next aspect. But before we do that, a dietary modification, we talked about that, and you said Mediterranean type diet,
Foods.
type foods.
Yeah.
Now, if one adopts all of that, so they start exercising, they start eating healthily, does one have to have treatment for diabetes, or can they manage it like that? I'll ask Dr.
It depends upon their investigation levels. HbA1c.
The what levels?
That is HbA1c.
Okay.
That is the test which usually gives us the sugar level for the past 3 months.
Okay.
And that is internationally recommended, and it should be between 4.5 to 5.5.
Okay.
And 5.5 4.5 to 5.5.
Okay.
And if it is greater than 5.5, that means the patient is having a pre-diabetes.
Okay.
And if it is greater than 6.5, the patient is type 2 diabetic. Okay, so from 6.5 up to 5.5, that is a stage where the patient can, where the person can control with diet and exercise.
Okay.
The patient can become diabetic later on if there is no diet control and no exercise.
Okay.
But they can delay and they can prevent it
Okay.
with proper lifestyle modification and exercise.
Okay. And now, if one does have to go to, if they're trying to do all of these things, but the weight is still an issue, they're still having problems, what are the alternative treatments for type 2 diabetes?
I think the best alternative treatment is the main treatment is the lifestyle modification and the diet. And if you see statistically, the studies have proved that if you take out of 100 patients, they take regular exercise and control the diets, 43% of the patients can remain free from the diabetes. It's a big number. It is bigger than the total efforts by all the pharmaceuticals and all the doctors. So it's something that should be addressed properly.
Okay.
We have discussed that,
Yes.
diet and exercise. After that, the first medicine, although we should not take the name of the medicine, but one medicine I will not hesitate to take the pharmacological name, and that's the metformin. Once diagnosed, and diagnosis is based upon the out of the three, like fasting blood sugar, blood sugar check 2 hours after the any meal,
Oral glucose
and the third one is the HbA1c, as Dr. Saab was saying.
Okay.
The oral glucose tolerance test, it's a very simple test where we load the body with the challenge of sugar with 75 grams of the sugar, which is 15 teaspoonful of the sugar in a glass of water.
Oh, wow.
And then we take the blood sugar before giving that load, after some time, and then repeat that again. And we have certain graphs where we expect the numbers to be.
Okay.
So if we diagnose these patients that these are the labeled diabetics, now starts the treatment. First, again, the lifestyle and the diet, followed by pharmacologicals.
Okay.
And the one medicine that I was just about to take the name is metformin.
Yes.
And that is the mainstay of treatment. It's very cost-effective medicine, comes with different brands throughout the world.
Okay.
And it has been recommended in almost each and every guidelines until it is contraindicated for certain reasons, and a doctor can definitely suggest how to.
Excellent. Okay, and now, so that's very important. Now, in regards to the tests that we're talking about, if one has a history of diabetes within the family, how regularly should someone get tested from the doctors?
That is after every year.
Every year.
Yeah, after every year, and if the patient is having pre-diabetes, after every 6 months, that patient should do all the investigations after every 6 months. Yeah.
Okay, 6 months. And after one has been diagnosed, you said 6 months.
Yeah, 6
every
months,
6 months. Okay. Now, we've just had a request of a question. And we have already explained this, but because it's one of our viewers who've just asked this, I've just threw my ear. They're saying that they say that you get diabetes or high blood sugar from having too much sugar.
Yeah, one can have, definitely.
Yeah, so that's right. You guys are right.
It's very simple.
Yeah.
Even if we do not have genetics, even if we are otherwise healthy, we take more sugar, we are likely to have diabetes after some times. As I was saying, the type 2 diabetes develops in a way that we are continuously taking more sugars, and after a certain time, the pancreas cells, beta cells, they are exhausted.
Okay.
They respond in a way, the more sugar comes, the more insulin is released. But unlike other body organs, the pancreatic cells, they die out after some time. We medically call them in the books as burnt out disease. They're burnt out. And once they are burnt out, then there is no insulin or less insulin, and then one is definitely a diabetic.
Okay, so there you go.
Even the medicines, I would say. I would like to add to this here. The medicines, certain medicines that patients are taking, we as a physicians, one have to prescribe these medicines. We have to tell the patients, we have to keep checking the blood sugar, like steroids. If we have to give to certain patients for a longer time, they are likely to cause the diabetes. Certain other medicines can cause diabetes,
Okay.
but these definitely are under the surveillance of the doctor and usually can be reverted once this medicine is stopped.
Okay, wonderful. So there's a lot of factors that we have to keep in mind. Now, going forward, say that, these are the people who are lucky enough to know the symptoms, have enough awareness, have access to treatment. But within Pakistan, as we mentioned at the beginning of the show, is that, in this, we're a developing country, there are a lot of issues that we're facing. So a lot of people don't have access to this information or proper doctors. What are the consequences of not treating diabetes? And unfortunately, even very educated families, go through these things. So tell us about that.
Consequences are very bad, and I think that is the reason that we are celebrating this day. If you see generally, any disease which is a silent disease is usually internationally celebrated in the form of some day. And if that is having serious consequences like diabetes, the diabetes has serious consequences because it remains silent for a longer time.
Okay.
And I often say that any disease which is a silent disease is a very bad disease, and it has got very life-threatening consequences in the form of, it can take its toll in the form of increased morbidity. Morbidity is a condition where the life quality is affected by hit on the various organs. From the diabetes, if we start, it's the stroke that is quite common in the diabetics because of atherosclerosis and the microvascular disease. And then the heart attacks because of the coronaries get atherosclerosis and other microvascular issues. Neuropathies. Neuropathy is a condition where the nerves are damaged because of the persistently raised diabetes. And the patients have gloves and stocking sort of distribution because these are long nerves, hands and feet. And many people even lose job because of these. And they do have diabetics ulcers because they do not feel any injury in the feet mostly. And they become infected because of the raised blood sugar level. And the kidneys, they are affected. And the renal failure and the loss of vision. This is, the diabetes is today the leading cause international worldwide. So it affects almost every organ.
Yes, sir.
I also want to add few words in Dr. Saab's discussion that there are actually two types of complications. One is the microvascular and other are the macrovascular. Dr. Saab has already discussed a lot about these heart attacks and all these things, but it usually affects the blood vessels, especially in the eyes, in the kidneys, and it remains silent. It remains they don't have any sign and symptoms of that. If the patient usually don't go for the test and the right test, they will be masked and the patient become nephropathic, retinopathic, and then there will be no reverse. And it's the leading cause of amputations in the worldwide as well. Amputation means that loss of limbs. So patients should take care of that as well.
Now, in regards to the loss of, because this year's theme is Eyes on Diabetes, because it's like you said, it's one of the leading causes of loss of vision. Within Pakistan, that's what's happening, and like you said, it's affecting people's livelihoods. Now, there's no signs and no symptoms. They don't have access to, adequate treatment or medical facilities. So what chance do they have?
I was initially in the program appreciating that everyone is now taking this responsibility internationally and locally as well. Every doctor, every physician, they're celebrating this diabetes day today to spread the awareness. And blood sugar test is a very simple, cost-effective test. Even if we let the patient and let the viewers know what are the symptoms, they can pick those symptoms and go to any lab even without going to the doctor and check their blood sugar level. It's very simple. 8 hours of fast, 8 hours of fast, and then giving fasting blood sample is something which is very cost effective and can be made available to anyone, anywhere in Pakistan. So this is something that we cannot even link with lower social class, that we cannot check the blood sugar level. after this is picked or diagnosed, then we should contact the physician. We should not remain in denial, and then see frequently doctors how to treat this diabetes if needed.
Because as we've already discussed, if the longer you delay it, the more
having the
chances of very bad things happening. Now, loss of vision is one of the main things, and that's the theme. But in regards to the stroke and heart attacks, does it play a huge amount in the figures of the casualties that we have here?
Yes.
Yeah.
And because of diabetes and
Yes,
the complications as a result?
Even most of the time, patients come up with complications. Complications in the form of maybe very simple, trivial early complication like pruritus in the genital area maybe, or maybe some weight loss or weakness. These are the early, or maybe diabetic ketoacidosis. It's a chemical situation where the acidic situation in the body is changed, and especially seen in type 1 diabetes in the kids, and it's a medical emergency and often picked as a surgical emergency. I've seen it myself, that these patients present with acute abdomen, and they're considered to be having either appendicitis or something like that. And the chronic complications may be loss of vision, because the microvascular, anywhere where the small blood vessels affected, and the vital organs starting from eyes, brain, heart, kidneys, and the peripheral vessels and the nerves. Once they are affected because the microvascular injury caused by the raised blood sugar on a chronic or a longer duration, these complications are likely to come up, and they do come up every day.
Yes. So now let me ask Dr. Wahab, you're an endocrinologist, so you see all these things. Now we've talked about the different ways to manage diabetes if one is suffering. We've already talked about foods, but we got another question in regards to alternative sugar. Is there anything alternative, like as in this certain fruits you eat, all this stuff? Is there anything else that someone can have apart from sugar too?
There are artificial sweeteners available all over the world, but I usually don't recommend that.
Okay.
I ask my patients that it's better to use honey instead of taking the artificial sugar.
Okay.
Honey, but in a very small amount.
Okay.
Yeah, honey in a very small amount.
Excellent. Honey is very good for you as well.
Yeah.
Oh, yeah, excellent. And another question.
But I would like to add here, although because this internationally, if you see, supply of the honey at even one stage, even in the developed country, was linked with some mixing with the corn syrup. Corn syrup is a very good name to the very high, even more dangerous than the sugar form. If you most of the time see those sweet chocolates and things, you will see at the back end that there is a corn syrup in that.
Yes, there is actually.
Yeah, it looks very nice and very mild and naive sort of thing. It's more dangerous than the sugar. It's main leading cause of obesity now, and the corn syrup is more cost effective to make at the industrial level, and it is more in caloric value, and it is more dangerous. So even this corn syrup was also added in the to make that artificial sort of honey, which is at times available, and people keep consuming that. So I would even slightly differ, although honey is the definitely good treatment, but because of non-availability.
Pure honey.
Pure honey.
Yeah, okay, let's be specific here.
Yes, pure honey. That should also be avoided if possible. And the artificial sweeteners, they do give you taste, but they are also chemicals. And the diabetes is a metabolic chemical disease, and the altered chemistry can further get aggravated, and they are pro-carcinogen.
Okay, so basically, if you can get pure honey, then try that, but otherwise, no.
I would say definitely.
Be very careful, because look out for corn syrup in the ingredients. No wonder like chocolate and all these things taste so good. Okay, now going forward, we've actually had another question. When people go for the, this is literally word by word question, because I'm not entirely sure I understand it, but when someone goes for their sugar tests and they do it with the needle, the question is, can it get transferred, or can your blood sugar come out wrong, or should it? I don't understand the question.
It cannot be transferred.
Yes.
Yeah. It is not a disease which can be transmitted to another patient or other individual.
Oh, okay, they're asking, okay, can you catch the disease?
No,
you
it's
can't
not.
catch diabetes.
No, it's not like that.
Okay,
it's
right.
not like hepatitis. It's not like any other disease like AIDS.
Okay.
So you are safe.
Okay.
You are safe.
Although
but
the doctor
definitely
should be using
but
clean.
definitely needle shearing
Precaution
should
should
not
be taken. Yeah, precaution should be taken.
needle
with that.
shearing still it's
Yeah.
not something that we
No,
are
no, you
doing.
shouldn't be sharing needles, full stop. If they're doing that in that clinic, you need to get out of there
Yeah.
Even
as
what
fast
I
as
have
possible.
seen, I tell my patients, many patients who have diabetes at home, they have glucometer available.
Yes.
And that's something which is very good, I must say.
Okay.
Home blood sugar monitoring devices. And there are likely chances that they do pick the same needle and prick their finger and then take the blood sample. Even that should be strictly
No,
discouraged.
that sounds wrong as well.
Yeah, but in the families, people, I have seen that at times they think that because it's the family needle, we should. Still,
it's
that
not.
should not. It's not a communicable disease, but the blood needle that can communicate so many other diseases along with that.
Exactly, and also it's not what's the word? What's the word I'm looking for? Sterile. So you should.
Yeah.
Yes,
Once it's been
yeah.
used, you should throw it away.
Yeah.
You know, there's no price for health. I mean, the consequences and the cost will increase if you do catch some sort of disease. Now, we are running a little bit short time, but we do have time for a few more questions. We've talked about some of the complications. Once you have the onset of the loss of vision, is there anything one can do to delay it, or the loss of vision, or kind of just stop it in its tracks? Or once you start to lose your vision, it's gone?
Okay. Loss of vision is the earliest thing which
Okay.
a diabetic patient can usually comes with. So I usually ask my patient to go immediately to an ophthalmologist
Okay.
for the consultation, because fundoscopy, this is the examination of the retina of your eyes.
Okay.
Okay, that is immediately required, because it will have few patients will be having a bleeding inside the vessels
Okay.
under your eyes, and that can be a cause of blurred vision. So annually they should consult after that, but immediately at the time of diagnosis they should immediately consult ophthalmologist for their eye consultation.
Okay.
Yeah.
And yeah.
And at that time laser may be required. Laser at the right time can prevent the eyes from further damage.
Okay, wonderful. So I hope that's got your question answered. Now, another question that we had is that once you're suffering from diabetes, can you live a normal life again?
Yeah, sure. There are people who are doing sports, who are celebrities. They are leading a perfectly normal life.
Okay.
It can be managed, it can be treated, and it can be further.
Like Wasim Akram,
Yeah,
one of
sure.
our own.
Yeah, I never wanted to name, but definitely he's a celebrity who is an icon of in Pakistan. He was well managing diabetes, and even he was a very good sportsman. There are so many people who
Okay.
are managing diabetes very
Okay,
nicely.
so it's not an excuse to say that you're ill and you can't
Yeah,
do
no.
this, or prevent your children from doing things.
Yeah. I want to add something
Yes,
that
please.
make a friendship with diabetes. It will always remain with you. Don't be afraid, don't be angry, don't be anguish. Make a friendship with diabetes. It will be your best friend, and you have to control your diabetes, otherwise it takes you in control.
Okay, and that's actually what I was leading on to, was that people suffering from diabetes, and also, in Pakistan we have lots of minor triggers. So if someone does have diabetes, then that's, quite a big deal for a lot of people. But in regards to once they have got diabetes and the psychological effect on it, how would you recommend someone to manage that? Because especially if a female gets it, or if a male, you know how melodramatic we can be, like, oh, my life is over,
Yeah.
I can't do this.
Yeah,
How would
actually-
you recommend?
Actually, I have seen that it's mostly the denial which is more common.
Okay.
And the people take diabetes very lightly. And they
Right.
think because it's a silent disease, they do not take it seriously. Definitely some patients, some ladies, maybe some gents maybe, who are once diagnosed to have diabetes, has some effect of their psychological stress, but they usually come out of that very soon. And this is the time that they should consult the doctor for stress and for the disease as well.
Okay.
But it's the denial which is more important. That's where I would like to say that we should make them have some fear about the diabetes, so that they do not take this as just a silent disease with no harms. And I would like to give 2-3 more messages
Please
here
do, yes.
because one, people in the treatment, they deny they have diabetes, I said. And secondly, once they are diagnosed, they usually refuse some treatments. They prefer oral treatments, maybe some tablets or some capsules, some sort of things. But once they are suggested by their physician to take the insulin, they have the myth that as if once they will be put on the insulin, that will stay with that. This myth is transferred because of the old insulins and the previous guidelines for the diabetes were different.
Right.
And the patients usually who had advanced diabetes in the past, usually they were put on the insulin. But today, the recommendations are preferably start the insulin once it is required, continue with the insulin. It's a very good safe treatment. There are so many good types of the insulin. There are a few medicines who are just like injected in the same way as insulin. I can not brand name them, but they are so good, they can prevent the organ damage as well.
Okay, wonderful.
They can bring the weight down in type 2 diabetics. So this is some message that should reach to the viewers as well, that insulin should not be denied. And treatment should not be stopped.
Exactly, I know, because I actually have quite a few uncles and aunts as well that they just don't do it, and it's like, why are you having this? You're diabetic, you're not supposed to eat it.
Even if you say your patients, I want to put you, no, Doctor Saab, I don't want to go on insulin. Please don't put me. Try oral medicine again.
Okay.
But we definitely encourage them. Then after some time, they do come on insulin.
Okay, great.
I have to add, yes. In Pakistan, we have patients which don't like insulin. They have a stigma. They have, as Dr. Saab said, they are actually afraid that it is the last treatment, and they will die after that. This situation is a bit realistic because the patients who were put on insulins, that was the last stage of their life, because they were already having kidney damage, eye damage. As I told you earlier,
delayed treatment, basically.
Delayed treatment. They should start listening to their doctors first, and then start insulin at their earliest.
Okay, great. And also, we actually have run out of time, but I just wanted to know one more question that we had was about the recovery. If, for example, if you're diabetic, but you have some sort of illness or you injure yourself, does that delay your recovery process?
Yes, diabetes can affect, for example, if someone is having a chronic wound, it is usually not healed. It does not heal so good in old diabetics. If someone is having cardiac disease, it is not well controlled if someone is having diabetes. And one important message that I should add here once we close this program. In various studies internationally on thousands of patients, we've been addressing that it's just blood sugar control which is the main savior. But now we have come up with few more studies now that all those patients where we were having very good glycemic control, still they were having still they were having complications. And what we have come up with one study, CENTOS 2 recently, that it's the other comorbid conditions, and specifically cardiovascular, that should be addressed at the same time. So any diabetic, they should have this message very clearly should reach them, that they should, if they are controlling their diabetes, they should control their blood pressure, their lipids, and also keep the few medicines for the heart, like we add ACE inhibitors. They prevent those complications which usually add to the mortality still in those who are well controlled. So this is something which is now coming up.
And Dr. Wahab is nodding, so you agree?
Yes, I agree.
Great. We've actually run out of time. Thank you so much for joining us today, and it's been very informative. I hope you have a good World Diabetes Day back at the clinic. But anyway, guys, I hope you took something away from the show. We tried to give you as much information as we could, and there's some gems of advice in there. So if you have missed it, you can catch the repeat at 11:05 p.m. Pakistani time. Wherever you are watching this on global, you have to deduct or subtract the time zone. So do log on to our Facebook fan page, which is with the name of World This Morning, our Twitter page, World This Morning without the G, our Daily Motion and YouTube page, World This Morning. And as I said, the repeat is at 11:05 p.m. We spoke about diabetes because it is World Diabetes Day. Look after yourselves, and I will see you bright and early tomorrow morning. Have a good day.